Welcome to the Quality of Life podcast, where we explore how hospice and palliative care may enhance quality of life for patients living with a serious illness. Here's your host, hospice and palliative care leader and educator, Dr. Millicent Burke-Sinclair.
Welcome to episode 4 of our podcast. Today we're going to be talking with two leaders at Four Seasons regarding aging in place and how to best support the caregiver. So welcome, Mary Jo. Welcome, Maureen. We're so excited that you're with us today. And let's just start out by letting those listeners know more about each of us. So Mary Jo, would you share a little bit about yourself and your background?
Sure. Mary Jo Powers, and I'm the director of the home care division here at Four Seasons. I'm a social worker by trade, and most of my background has been in nonprofit leadership. I came to Four Seasons 5 years ago to run the home care division, and really became interested in this work through helping my own parents. Both of my parents went through episodes that I was their caregiver. And so it really turned my heart into wanting to help those that were aging, to be able to have someone to care for them. And so home care is a perfect fit for me for that.
Oh, we're so grateful that you came to be with us and have certainly helped our home care program to become not only well trusted in the community, but nationally known. And so in a little bit, I'm going to ask you to tell us about that. And then we also have another very important guest with us today, Maureen, who is a leader with Four Seasons also. Would you be willing to share some about yourself?
Absolutely. I'm Maureen Williams. I'm the Director of Care Navigation here at Four Seasons. And this is a service line that we developed about 8 years ago to better help people live well and age well in their homes, to age in their communities, to age in place. Yes. And so that's what I do here at Four Seasons. But I've been here for over 10 years in many capacities. By background, I'm a registered nurse. I've been an administrator. I've been an educator. I've worn many, many hats here at Four Seasons over these last 10 plus years. And right now, as the Director of Care Navigation, I'm also a certified care manager, and I'm a certified dementia care partner. And we'll talk about some of those pieces in just a moment as well.
Wow. Thank you so much for sharing that, both of you. And it makes me think about a question for you, Maureen, about what does it mean to age in place? I mean, we know that there's so many individuals who are aging and need support with aging, but what does the aging in place mean, and how can we help?
We ask that a lot in the community. Many people say, oh, everyone wants to age in place. What does it mean? Believe it or not, the Centers for Disease Control has a definition. Woo! But it kind of works here. And it's really one who is able to live independently, comfortably, and safely in one's own home or community, regardless of age, ability, or function. Just they're able to live comfortably, safely, and independently with supports. And really, most everyone, if you ask, where would you like to grow old, so to speak, or where would you like to age? It's at home.
Yes.
So that's what to age in place means.
And there's ways that Four Seasons can help with that. And Mary Jo, I wonder if you might be willing to share about our home care program. And one question that we often get is, what is the difference between home care and home health? Certainly, if I want to age in place or my loved one wants to age in place, I want to know the difference to make sure I have the right support. Could you share that with us?
Sure. Home care is to provide personal care for someone. It's not medical care. It is not the difference. Home health is like wound care, PT, OT, those type services that come into the home and provide more of a medical service. Our personal care can be as little as transportation, can be helping with meals, running errands, doctor's appointments, all the way up to helping with incontinent care, transfers, someone who's bedbound, helping with changing someone, feeding, all of those things. So it's a full range of services, but not medical service.
One question that listeners may be thinking is, who is a caregiver? Would you care to share?
Sure. So it can be complicated sometimes because we use words interchangeably. So for us, and the way I try and say it, is a family caregiver is someone that's a member of that client's family that provides them with either daily care or intermittent care, whatever they need. And then for us, a caregiver is the professional person that we hire that comes into the home to provide that support. And for Four Seasons and for home care agencies, you do not have to be a licensed person to be a caregiver. We always say when we're interviewing people, the number one thing we're looking for is someone with a caring heart.
Yes.
And someone that wants to give care to another individual. We can teach you some of the skills, but it really is all about that compassion and passion you have for caring for others. And so for us, that's what a caregiver is.
Mm-hmm. That's really important. And one thing that you said, you were explaining about all the support services that are possible through home care, and it made me think about how home care can also help the caregiver or those loved ones. Could you talk about that a bit?
Sure. One of the things that we get asked for a lot is for someone to come into the home to give the family respite.
Yes.
And so we can send a home care, one of our home caregivers into the home to give the family home caregiver a break. So whether they just need to go out to run errands, go to their own appointments, to just have a break, because it is hard work to take care of someone who's needing a lot of personal care.
Mm-hmm. You know, one thing that made me think about whenever you were saying a break and someone to, in a sense, provide that additional support made me think about our care navigation services. And so, Maureen, whenever you talk with people throughout the community about what care navigation is, certainly I believe that it's very complementary to the focus around aging in place. In fact, it's crucial, similar to how home care is crucial for those that are wanting to age in place and need some additional support. Could you talk about how care navigation also provides additional support, but in a different way?
Care navigation actually is a primary tool for people to be able to age in place successfully. So what is care navigation? We focus on navigating the healthcare system, because I jokingly say it's confusing to all of us who work in it. And for people who really don't know what they don't know, it's even worse. So many people engage our services for advocacy, to accompany them to medical appointments, to arrange for a proper skills and diagnostic work, to make sure they're getting a good medical plan. We help with life transitions. Maybe it's time to bring on additional help or support in the home in different ways. Or maybe it's time to transition to an assisted living community or a skilled nursing community. We identify community resources, much like Four Seasons Home Care. We refer a lot to Four Seasons Home Care and other home care agencies, or to our palliative care program, because people are frequently contacting Four Seasons at a time of medical crisis. So we'll navigate them to palliative care. We also help them with planning. Lots and lots and lots of planning for now, for the future, for the what ifs. Could be healthcare discussions, could be financial discussions, could be legal discussions. We'll get them pointed in the right direction. And in all things, we're trying to educate people on their options and accepting their choices. So it's a real comprehensive way for us to really develop a very deep relationship with people over years, quite honestly, at times, to help them live well and age well.
It's so important what you just said. And, you know, if I was a caregiver of a loved one, I would be, number one, so satisfied with what you just shared, I'd be calling now. But number two, I would be saying, okay, how do I know that I can be confident in the services that y'all are going to provide? So I have a question for Mary Jo, and then we're going to go back to Maureen, because Four Seasons provides a lot of services that help not only the patient, but also the family and those most involved individuals like caregivers. So Mary Jo, when we think about home care, we have something really special with our home care program that not only is it trusted locally, but nationally. Could you talk about that? Because I think, again, as a loved one or a caregiver, I want to make sure that I can trust who is going to take care of my loved one.
Right.
Yeah.
So one of the things that we do is we're part of what's called Home Care Pulse. And that is an organization, third-party organization that does surveys of our caregivers and our clients every single month to see what their satisfaction is with our services. Over the last 6 years, we have received the highest awards available through that survey process, which is awesome. And this year, we actually were number 6 in the nation. Woo! So people that call us can know that we are providing a service that our own clients are saying that it's a service, and they're very satisfied with what we're doing for them.
To me, that is just that peace of mind that so many people need and deserve. And I'm grateful that you took the time to explain that. And certainly listeners can go to our website and read even more about our commitments. But this makes me think, Maureen, about other services that Four Seasons has to offer to support the caregiver. And feel free to take it from there.
Sure. In addition to home care, which is, as Mary Jo described, can even provide respite for caregivers and provide lots of professional caregivers to help. Care navigation also helps connect people to caregivers. And for some people, as a care navigator, I'm kind of like a primary caregiver, care coordinator. But then let's go a little bit further into our palliative care program. Many times our palliative care professionals are connecting and collaborating with the patient. In that case, Mary Jo and I serve clients. Then they become patients when you're into a medical model. Help the caregivers understand the whole medical picture, the big picture, and their options for service. And then once you get to hospice, I always give you the big hug. I'm doing that motion right now. It's the huge hospice hug that patients and families, caregivers get when their loved one is being served by hospice. I mean, that's the biggest hug of all that they get is hospice care. So in addition to just being that, we also train caregivers, all of us, all along our care continuum. We train our caregivers, and then even beyond the hospice services we provide grief services to the caregivers who provided care to a loved one under hospice care. It's a really comprehensive package for caregivers here at Four Seasons.
Thank you for sharing that. And this makes me think, Maureen, about a special certification that you have, and you have really delved into becoming an expert in dementia care. Could you talk a little bit about that? Because I think what's really important is while we serve patients, clients with all different diagnoses, one of the most often that we'll see is patients with dementia. And so could you share a little bit about that?
Absolutely. So I worked with another independent company to take a training class on how to be a certified dementia care partner because I wanted to know, do I really know all I need to know about dementia?
Yeah.
And the answer was no. A decisive no, and that's okay. And what I learned is some perspectives and some techniques, in particular for communicating with people with dementia. And for example, people living with dementia, I just caught myself. One of the ways we want to reframe this is to really not refer to these as a dementia patient or a dementia client. These are human beings living with dementia.
Yes.
They're human beings first.
Yes.
And then that frames the whole perspective thereafter. And some of the techniques we were taught are based in the Montessori world and some other great models of care, but really how to communicate with the person living with dementia so it optimizes his or her quality of life. Because many of them know they're living with dementia for a long, long time. So it's really to optimize their quality of life, their function, to help their family caregivers and their family members, and really to help them live well and age well. So that, plus, may I speak about the other services that we offer to people who are living with dementia?
Yes.
In each of our service lines here, home care, care navigation, palliative care, and hospice care, we all have received special training on how to serve people who are living with dementia. From our caregivers with home care and care navigation, as we help people navigate the healthcare system, for our clients, to the palliative care providers and the hospice team members. In fact, our focus this year at Four Seasons for educational purposes and staff development is on dementia care and for people living with dementia. And so we're really taking this to heart. We want to lead with heart and with our minds for people who are really faced with a very horrible diagnosis that they did not expect, they did not ask for, and yet it's thrust upon them. So we want them to live well as they can.
Impacts their entire life and their loved ones. Thank you for sharing that. And going a step further, it makes me think, Mary Jo, would you be willing to share about how home care helps with people who are living with dementia?
Yeah, absolutely. So one of the things is engagement.
Yes.
And keeping the client engaged, having socialization, having somebody different to come in, because sometimes, again, if you're caring for someone with dementia, it's exhausting. And so to have somebody else to come in and to engage that person, we had one caregiver that all she did was she came in and went for hikes because he loved to be outside, but he couldn't be safe. And he didn't want his wife following him in the car. And so she would go once a week and they would go for hikes around the neighborhood. But he loved it, and that kept him happy, and he was telling her about everything he remembered on the hike. And she learned so much from him But it was also for him such a great, gratifying thing because it's something he loved to do. Gardening, people going out and working in the garden, the things that they remember that really bring them joy, music, those kinds of things. Our caregivers do that and engage with them to help give them just another sense of connection and another sense of somebody understanding and accepting them.
Oh, thank you so much for sharing that. And that actually makes me think in conclusion of our time together today, I'd love to hear something from each of you around what do we want listeners to know when they think about our commitment to co-creating the best care for those aging in place and supporting the caregiver. And perhaps one of you would be willing to even define what does co-creating mean? And then how can care navigation, home care, and Four Seasons support?
Yeah, I think for us, when you think of the word home care, is the fact that we go into the home. Wherever, as aging in place, whatever you call home, we will come to you. And to build that relationship. Home care is about relationships.
Oh, wow.
It's getting to know the person where they are and helping them to be the best they can be at that place. And it's even someone who's on hospice care, who may be bedridden, but to have that person there to give that loving care for them and to spend that time in that relationship. And so that's why home care is so special, is because it really does connect to the individual that we are caring for and provide that support.
I love that. Connecting and relationship. That's 100% what co-creating is. Oh, I love it.
Exactly. You just couldn't have said any better. Relationships are about co-creating the care experience. And the most important question that we ask all of our clients or patients, and here's where quality of life is. We ask them this question: what is most important to you?
Oh, yes.
And we listen. And that's the care plan. And that is quality of life.
Well, what a perfect way to end this time today. Thank you, Maureen. Thank you, Mary Jo. For our listeners, thank you for your time. And if you'd like to learn more about care navigation or home care or any of our services, please visit us on our website at www.fourseasonscare.org.
Quality of Life podcast is produced by Four Seasons, the care you trust, providing award-winning quality hospice and palliative care to Western North Carolina. For more information, visit fourseasonscare.org or call 866-466-9734.